to people kind of your background a little bit and the research that you do and basically why they should listen to anything you say?
Yeah, it's a good question. So I am a virologist. I've been studying viruses for 40 years. I have a lab at Columbia. I do research on viruses. We study them and see how they work, how they cause disease. I also do a lot of teaching. I teach virology courses. I have podcasts. I've written a virology textbook as well. So I live, eat, and think viruses 24/7 pretty much. So that's why people might want to listen, because I've been working on them for ages.
So I'll tell you, I think I started listening to the podcast back in early March. So I can't say I've been listening for forever, but I interviewed an epidemiologist here, and she told me, you should listen to the This Week in Virology podcast.
Oh, cool. Very cool.
All right, I'll give it a shot. So I did. And she used to be a part of the health department here in the
cool.
state. But anyway, I'm curious how you've seen the number of cases, the number of listeners or emails that you are getting grow as the coronavirus has kind of spread. Because I imagine, much like myself, there's an increased interest from people in just getting into the nitty gritty about viruses that didn't exist before.
Oh, the surge has been huge. So starting in January, I think we did our first episode on the virus when it was starting to circulate in China. And every episode since then has pretty much been on the virus. And we're doing 2 or 3 a week actually now. So our listeners have gone up 25-fold since January. And I get over 100 email questions a day now, steadily, from all kinds of people who are like yourself. They just discovered us and they have questions. But, who can people ask when they have questions about viruses, right? You watch the news, that you can't ask questions, right? So people are turning to us and they're really grateful. And we try and answer them on every episode. We just did a 2.5-hour episode today, so we're trying to get through. So it's really remarkable. People find the good stuff, I guess.
Well, you talked about the news, and it's interesting. We all see everything. When I watch a newscast, I see it through my lens, and I'm curious, what have you been paying the closest attention to as more and more information's come out from January to now? Because this is something that, no matter who you talk to, they say that what we're learning seems to change every day, and I'm curious, what you pay the most attention.
Well, the some of the things I look at. First, I think the most important thing is testing for infection, which the U.S. got started really slowly in doing. Really only in March did we start, and even now it's not testing very much. And that's too bad, because the numbers we see, if you go to most websites or TV news programs, they'll have numbers, but the actual numbers are probably 10, 20-fold more than that. There are many more people being infected. And I'm always trying to figure out how we can get that information. And it's just not even on a country by country basis. So I've been following that. I'm also interested in the lethality, right? Who is getting very sick? And one really interesting aspect of this particular virus is that 80% of the infections are pretty mild as infections go, and you might not even know you have it, or you might think you have a cold or something. And so we don't worry about those. It's the 20% where people have to go to the hospital that we worry about. And so I'm very interested in those. And what has been fascinating is to see how the kinds of illnesses those people have diversified since the beginning. So initially it was, severe pneumonia, and then blood clots, infection of other organs, neurological complications, and more recently, interesting syndromes in young kids, hyperinflammatory syndrome. And that's been fascinating because, as with any infection, there are always the main symptoms, and then there's minor stuff. In this case, there's so many people being infected, the minor symptoms are really starting to show through now. And that's quite interesting. And of course, the final thing is I'm really interested to see how how physicians are treating these patients, what's available to them. And a number of antivirals and other approaches have been tested and are still being tested, of course. And it's interesting to see if any of those, so far, none of them have really made an impact, but it would be nice if we had, of course, at this time.
Right. You talked to Daniel Griffin about all that stuff in the episodes.
Yeah.
And that's been, I'll tell you, we've gotten more than a fair share of story ideas off of those, because that was somebody who's really on the front line, and New York
Sure.
was certainly ahead of Texas here as far as what we're experiencing. You talk about treatments, the thing that people, I asked on, social media, I said, what are the, the virology questions that you have? What do you want to know? And a lot of the questions really had to do with, when is a vaccine finally going to be here? I know that's a tough question to answer. Nobody truly knows the answer, and everybody's working hard on it. But from the papers that you read and the research you see, I mean, what are you thinking as far as a realistic timeline?
So, as you know, there are over 60 or 70 different vaccines in development in various countries around the world. And a few of them have just finished their first phase of human trials. And they've shown, which we do to make sure they're safe, right? And so now a few of them are moving into what we call efficacy trials, and where you give the vaccine to people, you have a control group who doesn't get it, and then you have them go out into the world and you see who gets infected and who doesn't, right? And we can do that now because the virus is still circulating, and there are a couple of vaccines are just entering that phase now, which is quite interesting. So the others are all trailing behind. Now let's take those, and one of them is the mRNA vaccine, for example. Let's see, if they start an efficacy trial this month, you figure 6 months minimum. That brings us to the fall. I have a feeling the circulation is going to start dropping precipitously. So maybe at the end of June, there are not going to be a lot of cases. So that'll make their numbers harder to interpret, right? Because they won't get as many people infected. But assuming they get good numbers now, so we could by September have, let's see, May, June, July, August, October, we might have the results of those efficacy trials. And that's when I think the next round of infections are going to begin. Now, it would be really unheard of to have a vaccine start in January and be licensed in October. And even Dr. Fauci has said January, which I've always thought is an optimistic timeline. I'm thinking more summer of 2021 in time for the fall of 2021. I could be surprised. I would, if so, I'm say, okay, as long as it's safe and effective, that works for me. But I would say, based on my experience, summer 2021, if it happens sooner, that'd be great.
The question people are going to have immediately following that is, does that mean we're locked down in our homes for forever at that point? I think Rich actually talked about, eventually 80% of the population is going to get it. Are we just going to have to continually loosen things and build herd immunity? What does the next few months until that summer look like to you?
So I think we need to come back to our normal lives, not completely yet, because it's going to take a while, but we have to start rolling in. And many states are doing this. I think if we do it properly, there's not going to be a danger of new outbreaks, okay? And what is properly? So we can look to some other countries for how they've done it. South Korea never shut down. Sweden has done limited closings, and they have kept the cases pretty low. So I think as we come back, we have to do a couple of things. First, restaurants, businesses, whatever we're talking about, they can't go at 100% capacity right away, right? It's going to be 25% or maybe 50% at the most. You have to space people apart. I think people should wear face masks for sure. And I also think we need to do extensive testing and just random testing of people, see who's positive, not serological, but an actual diagnostic test. And then if they are positive, you quarantine them and then all the people they've been in contact with. And that's a good way to really keep down circulation, which South Korea proved will work. And I think if we do that, we can gradually go back to work. And maybe even in September, we can go back to school, which I think is important to get things back to a semblance of normalcy. So to answer your question, I don't think we have to stay locked down until next summer, not at all. But how we go back is really important. And that's why there's so much debate about it now.
You talked about serological tests, and I'm glad you touched on that for a second, because I'll tell you, when I get the chance to talk to our county leaders and health directors and stuff, there's definitely mixed opinions on whether we should put any stock in that at all, because I'll tell you, frankly, that the questions they ask are, well, is it 100% going to tell me if I've had this, or will it show me that I've had the common cold? And it's like, well, we don't know, but, PCR tests aren't exactly accurate. So that's a long-winded way of saying, how much stock should we put into serological tests versus PCR tests? I mean, where do we need to be focusing the most here?
Well, I think we need to have both. Okay, the PCR tests are pretty good, and I think we have to, as I said, we have to continue PCR to see who's infected and quarantine them. Otherwise, it's going to spread, and we don't want to overburden the hospitals again. That's the problem. So PCR will continue, but the serological tests are just rolling out, and there are a lot of them, and not all of them are as accurate as others. Last week this week, I'm losing track of the weeks. This week, Roche came out with an antibody test that they say is 100% accurate, and others are 90% or so. So the high accuracy ones are great, and those will be useful going forward. Now, the real question is, we'll get past the accuracy issues, and eventually many tests will be accurate and specific, as you said. Make sure you're just picking up SARS-CoV-2 antibodies. The real question is, what does this mean? Does this mean you're protected? And we don't know the answer to that yet, right? People, when they're infected with a virus, they make antibodies, and some of those antibodies protect you, and the others don't. They're just made incidentally. That's the way it works. And these rapid tests that are being done don't distinguish between those two kinds of antibodies. And that needs to be done. And many people are working very hard on that to say, well, if I get a band on my quick antibody test, does that mean I'm protected? People are working on it to try and sort that out. And I think we'll know that in the next couple of weeks. So then you could say, here, you're positive, you're antibody positive, you're protected, you should be fine. And that would be important.
One of the, I think, moments that was most fascinating for me is, you mentioned South Korea never shut down earlier, we're comparing, a lot of people in the news or pundits or even scientists compare the South Korean response and the US response because first cases happened at the same time. What did they do right, and how much did MERS, that experience, play into the way things played out there?
So it was SARS, right? SARS-1, 2002, 2003, which happened in China, very close to South Korea. And they had a number of SARS-1 cases. So they learned from that. And so did China, actually. So what did South Korea do? A couple of things. First, they had a pandemic plan, which would say, okay, if something is circulating, here's what we do. And that includes ramping up production of face masks and personal protective equipment. And they were able to ramp up face mask productions amazing, from like 1.5 million to 20 millions or more. And I forgot the time period, but they could ramp that up, and that allowed them to protect their population. So that's one thing. Secondly, they started to ramp up hospital capacity, building portable hospitals, if you will, where patients could be put. And finally, they started testing. They immediately purchased a test that had been manufactured by someone else. And in January, they started testing everyone. And they found people who are positive, and then they quarantined them and all their contacts. And because of those things, they limited the spread, and they also limited the impact of the virus on the hospital system. And that's been amazing at keeping their numbers down. It actually worked. And they didn't have to close down their country. I think schools closed, and there was slightly restricted travel, I believe, but people were still going to work. Now I understand they're starting baseball, although the stadiums are going to be empty, right? They're just going to play the games. So they have really thought about this. And you're right. It's because of the SARS-1 experience. They knew that was close to home. They made a plan. They spent money on it, which is what you have to do. And they were ready. It's just great.
For me, when you look at the way it spread out, I remember distinctly seeing the video of those trucks in China building like a hospital in a day,
Yeah.
Something along those lines. And I think that was the moment for me when I thought, all right, this is going to be probably serious. I'm curious, from both a virology standpoint and just looking around, was there a moment to you where you went from, oh, this is a new virus that I'm studying, to, hey, this is going to be really serious?
So we watched them starting in January when the first reports came out. And I taught a virology class this past semester. And so before each lecture, I would go through the cases and what was happening. And I remember for many weeks, the cases just built up in China. There was a few overseas here and there, one in Washington here in the US in January. I was very surprised that it wasn't spreading more quickly to other countries. And so I would say for January and much of February, we weren't too alarmed. On our podcast, we said, well, we didn't think this was going to amount to be anything. And part of the reason was because of the SARS-1 experience, where it had been basically within a year, it was stopped, and there were only 8,000 global cases. But then at the end of February, you start to see cases elsewhere in the world. And then at that point, it was clear that this was going to spread, and we couldn't control it. But it did take a long time to get to that point. And I admit that we didn't think it was going to be an issue initially, but boy, sure turned out to be one, right?
Right. As far as things that could have been done, I mean, you wrote, I don't want to put words in your mouth, but I think the headline might have been like, this could have been prevented or something along those lines, but it was talking about pharmaceutical production. Walk me through the short answer of kind of your message there.
So I think we could have prevented this whole outbreak starting in China, and that would have been to have drugs available that could inhibit any coronavirus, right? Pan-coronavirus drugs. And we could have done that because we knew after SARS-1 that bats in China had SARS-like coronaviruses. We didn't know that before. And it would have been pretty straightforward to get a few of those, isolate a few of those, and develop drugs that block them. And you could take a whole range of them from bats, from the whole range of how much they differ, test them all for antivirals, and pick some that would inhibit all of them. And then we'd be ready. Now, why didn't we do that? Well, SARS disappeared in 2003. And so the companies who make these drugs, there's no financial basis for them to do it because there's no market. So you would have to say, let's make this and spend a lot of money and have it ready. And that's not the way companies work. So, if somehow we can get around that model, even governments have to participate, nonprofits, we could have been ready. So let's learn from this lesson and be ready for the next one. We can do that.
So one of the things that I want to I guess accomplish with this is reach people on a level of answering, like I said, some of the basics questions they want to know. Is there, when you're getting those emails or just talking to people, is there a common rumor or myth or mistruth that you're hearing repeatedly that you want to make sure people know?
Well, I tell you, if there's one thing that's been persisting through this whole outbreak from January to today, and it's still going, it's this idea that this virus came from a lab in China, right? And back in January, we talked about it and told people why it wasn't possible, and it still persists. It's amazing. And it seems like every week people come up with new ideas about how this could have happened. And we just over and over address this on our podcast that, we have the sequence of this virus. We know it's a bat virus, basically. There's just no way anyone could have made this and released it from a lab. It's quite clear. And today, even on TWIV, we had to go through the whole thing again. That is the most persistent rumor and thing that we've had to deal with. It's amazing.
Well, I'll tell you, there was a headline that was circulating. Another thing you guys talk about is mutations, and that was the headline that was circulating earlier this week, which was, this new strain is I think it was more transmissible, or maybe it was more deadly.
That's right. So that's another thing that's been, thank you for reminding me, pretty much since we started and had more than one genome sequence. People say, oh, look, there's some mutations. It must be making it more virulent or more transmissible. Or one was that the cases in New York and West Coast and East Coast were different. So it must be that the genome mutated, right? So we try and tell people, no, this virus, every virus as it multiplies, mutations occur. And most of the time they don't mean anything. And until you have evidence that they mean something, you can't assume that. And so far, no, there are no more virulent strains than others. There's no more transmissible. There's just one strain, and it seems to be pretty much all the same. And what we have is a lot of isolates from patients that have sequence differences, but they don't mean anything. They're all the same.
So This is our first big pandemic. Everybody references 1918, but one thing I've been thinking about since the beginning is what's to stop a different virus or a variation of this virus from, coming up in a year or 10 years, basically what's to stop another pandemic from happening, just down the road as opposed to 100 years from now?
Well, what we can learn from is history, right? Pandemics don't happen every year, more or less. If the flu pandemics are every 20, 30, 40 years. So the last one we had was 2009. So we could have another one of those any year now. The coronaviruses have been every decade so far, right? SARS-1 followed by MERS in 2012, and now we have SARS-CoV-2. So within the next 10 years, we'll probably have another coronavirus somewhere. And so there's no question it's going to happen. There is no question. Just because we had this one doesn't mean there won't be another. So we need to be ready for it, really.
Does this seem like the kind of thing that that is going to be seasonal, or is this like, hey, once we have that vaccine, we should be good? I mean, I know that's speculation, so explain however you'd like.
So let me speculate, and we have some data to base speculating on. First of all, we have other coronaviruses that infect humans. We call them common cold coronaviruses, and they're seasonal. They come in the winter, you get colds, it's possibly a coronavirus causing it. They're usually pretty mild. And the way they work is you get infected as a kid, first 10 years of life. You don't get any disease most of the time. And then you get some immunity, but it's not enough to prevent subsequent infections. So you get very mild infections. But the point is that you're infected at a young age, so you never get that first infection when you're older. And that's the problem with SARS-CoV-2. Got a lot of people who are getting infected at an old age, and with the corona, that's apparently not good. So what I think is those viruses, those common cold viruses, by the way, they're seasonal. And so I think this is going to be seasonal as well. I can't prove it, obviously, and a lot of people think one way or the other. But I think eventually when we get to high population immunity, it'll become seasonal. And I also think that within 4 or 5 years, maybe when the entire population has been infected, when we have a vaccine that confers immunity, especially to older people so they don't get serious disease, this will be a seasonal common cold causing corona. It'll be part of the normal common colds every winter. It'll be mild. We may not even need a vaccine in 4 or 5 years. Now is when we need it.
So one thing that I think is one idea that's been particularly prevalent here in Texas because it gets so hot. I mean, I think it's 75 today, but we've had many days in the 90s and we got days in the hundreds coming up. Do we know how much heat plays a factor in killing off this virus and protecting people? That's another thing a lot of people like to bring up.
Yeah. So when you have a seasonal virus like flu or common cold viruses, what happens is they circulate extensively in the winter. You build up population immunity. And then in the spring, when it gets warm and high humidity, that impacts transmission together with the immunity. All right. So the heat inactivates the virus that you're expelling in your droplets more quickly than normal. The humidity, the rising humidity makes the droplets that you're expelling fall to the ground much quicker. They don't go a couple of feet, they fall right in front of you. So those two things plus population immunity, they make circulation stop in the spring. Now, the problem with this virus is, we have warm weather, we have high humidity coming, but there's still very little population immunity. So it could be that the virus will continue to circulate even though it's hot and humid because there's a lot of people that are susceptible to infection. We just don't know. We're going to see. Right now, the numbers are dropping pretty much everywhere, and that may be partly sheltering, partly immunity, and partly the warmer temperatures.
The only other thing I had for you was just from a research standpoint or a learning standpoint, the learning curve was certainly steep. Has it plateaued at all? Is it still steep? And what is really left to learn that you kind of are looking for? What's the next thing on the horizon that we're all trying to figure out?
I think there are quite a few things here. One of them is where it came from, right? We know it's a bad virus, but we don't know how it got into people. That's important to know because it would help to prevent the next one, to know exactly how it gets into people. The other thing is how much immunity do you get after being infected? Do you Are you going to be resistant to infection? Is there going to be a fraction of the population that's not resistant? Some of the things we've talked about, I'd like to see the numbers going down with the warm weather, whether that's going to happen or not. I'd like to know if we can develop antivirals any quicker than the current trajectory, because that would really help impact the outbreak. But mostly, I think the origin is really important, and I think that could inform us to stopping the next one.
And the only other thing I got for you is we're we're reporting every day on this. I'm curious, when you watch news or read articles, is there something that you kind of shake your fist at that you wish we were talking about that we're not, or sharing that we're not?
I think the strengths and weaknesses of the antibody tests need to be emphasized. Those two things. That I don't think you talk enough about the questions whether an antibody test means anything, because states are putting a lot of weight on them and saying, okay, if you're antibody positive, you can go back to work. But I don't think we know the answer to that. And people should know, because I've heard stories of people getting positive antibody tests and they say, oh, I'm immune, I'm not going to wash my hands anymore. So I don't think we should do that. And I think the other thing that has to be hammered in, which is sometimes forgotten, is that even though the virus numbers are going down, the virus is still around and it can still infect you. So you have to be careful when you're going back to work. You have to take precautions still. And then only if we do that can we limit the spread. I think the news is not emphasizing that enough.
So it makes it sound like you think that we're going to go down and then truly have a second wave. Is that inaccurate?
Well, it'll be like a season, right? Because in the fall, when the temperatures drop and the humidity drops, then human-to-human transmission will increase. There will always be some infected people around, but there'll be small numbers. And then those will grow in October-ish as the transmission gets more efficient, and we'll have another mini outbreak in the fall. I think we can keep it not serious if we still follow our precautions and if we still test and contact trace and all that. But yes, we will have another outbreak. It will end in probably May or June of 2021. And then hopefully next summer we have the vaccine that would prevent the next fall outbreak in 2021. That's my thinking.
There's a lot of football fans in Texas that just got very nervous when you said we're going to have another outbreak in the fall. That might mean no fans in the stands ever this year.
I don't know. I think you could have fans if you space them out, but that's not much of a game when you see the stadium half empty, right?
Yeah, that's the truth. All right. Well, anything else that I didn't ask you? I really do appreciate your time. Anything else that you want to make sure that you share? I feel like you've covered a lot of it, but I want to give that opportunity.
Yeah, I think people should understand this is not going to last forever. They're going to be able to start going back to work soon. A lot of people despair and think, oh, do I have to stay home until next summer? And the answer is no. We're going to slowly get out this summer. And I think in the fall, we'll go back to school. So I wouldn't worry about it, because I know a lot of people get bothered. It makes a toll on them, so just keep the faith. It'll work.
Awesome. Well, thanks again. I really do appreciate your time and everything. And